I am particularly delighted to welcome the members of the board of Elizabeth Cottage, including Board Chair Anne Zarichny, Jean Wilson, Carol Jeffrey, Karen Nickel, there's Karen, Ruth O'Brien, and Linda Patry, and Sharon Wainman. And we are delighted to have all of you here today. It was my pleasure to get a glimpse of the incredible and passionate service that these women provided to older female residents of our community for many, many years when I attended a very emotional meeting with the families who had loved ones being cared for at Elizabeth Cottage, where they learned that the cottage would not continue. And I have to tell you, in the course of attending that meeting, that I just got a glimpse of what a labor of love and what a passion and what a focus of service Elizabeth Cottage was for these women who for many, many years tried to figure out a way to keep this incredible support to women in our community going. And I know that it was a very emotional decision to determine that you couldn't continue, but I am so thrilled that you've made a decision to support elderly patients in our community through your wonderful gift here at Kingston General Hospital. So I'm not going to give all the details away, but I did want to just extend a very warm welcome and let you know that my heart has really been touched by your commitment to women in this community and the care that I've seen you providing them.
Made some great friends on the board of directors. The ladies who lived at Elizabeth Cottage were just amazing. We had one lady there who was over 100 years old who ran up and down the stairs and did the dishes. Mrs. Tetlow, she was just incredible. And we had many incredible women. And to close it down was very difficult for all of us, and for many varied reasons, we did have to close it down. It had outlived its mandate in a way. Retirement homes were they were popping up like mushrooms, and we couldn't update our building to accommodate everything that needed to be done in order to bring that up to scale with the other homes. Plus, there were some government mandates that came out that we couldn't accommodate either. Sprinkler systems, we needed to make a very long story short, a couple of $1 million to accommodate 13 women, and it just wasn't going to work. So that's why we closed it. Now, Louisa Fowler, right? In her will, she made a statement that she wanted to make sure that KGH, Queen's University, and St. Andrew's Church were her beneficiaries. And even though legally we did not have to honor that because everyone had signed off on it, we felt that it was really important that we do that. So that's what we did. We sold the property, and all of the proceeds from that property, minus of course our legal expenses and stuff, went to KGH, the Ben Ree Foundation at Queen's University, and St. Andrew's Church. The exact numbers, do you have those, Denise? I'm not sure. $340,000. $170 to St. Andrew's. Okay. So that's why we're here today. So we're very happy to make sure that, to ensure that this money is going to be used for elderly people in various ways in the hospital, because I know there are just 1,000,001 things you can do with it, from putting up ramps to whatever. And I thank you for letting us come here today and speak to you and let you know how this all happened. So thank you.
This generous contribution will allow regulated allied healthcare professionals from across the organization to have an opportunity to develop their knowledge and skills when working with the elderly patients. This endowment will open up many opportunities that otherwise would not have been possible. Many staff from the allied health disciplines, and I think Adrian would agree with me, have a passion and a drive for knowledge and are committed to continuing professional development, but do not have access to funding to further their educational endeavors. This endowment fund will help to make lifelong learning more accessible for them. Words cannot express the appreciation our allied care providers have for your support, and on behalf of all of them, I would like to sincerely thank you for your generosity.
I was thinking as you were talking that, you know, I get a lot of pleasure out of those pewter ornaments that the downtown Kingston has, and when I put up Elizabeth Cottage this year, I'll have this in my mind, and it's interesting when you have one of those little collections of pewter ornaments, you think about each one as you put them on the tree. And I guess I really haven't ever really thought an awful lot about Elizabeth Cottage. It was just one of those pretty nice places, and I knew where it was and what it did generally, but now it'll have a special spot, and thank you for that. I think when you share your money, or this gift from Louise Fowler, with the people who are working in our hospitals to further their education, you couldn't give a better gift. I meet with so many different people in different ways in the hospital, and I know how much continuing education is important to them. And to have a fund that they can apply to get them to that one more conference, or to open the door to a workshop of some sort, is a really marvelous gift that will just continue to give and give and give. And to have that money put in an endowment so it kind of lasts forever, I think is wonderful. So thank you so very much for honoring her memory in this way, and for giving me another memory of Elizabeth Cottage. Thank you.
Your courage, the determination, the passion that you have brought together with all of you who have made Elizabeth Cottage such a valuable part of the community for so many years, we want to say thank you, because even as you have chosen to honor others with the gift of and the legacy, really, of Elizabeth Cottage for continuing education at the hospital, I think that we will always be reminded, and we will, my commitment on behalf of the staff and the patients will be to honor, I think, the attributes that you have displayed in providing the care, the compassion, the vitality of your spirit and those that you've served over the years. That will be our guiding force and the principles in honoring and providing this, the funds to people who are choosing, who will apply and be part of the beneficiaries of the education going forward. So please know it. We will do everything we can to make sure that as people benefit, that they will have your spirit, your stamp, your footsteps acknowledged and supported, and we will do our best to live to the standard that you would want to see anybody who benefits from the funds that you have chosen to provide to us. We will uphold that with the greatest of pride and spirit that you have started, and thank you for allowing us to be able to continue the focus and the memory and the incredible kind of standard and spirit that you have created, and help others have that live on.